Hi, this is Dr. Bob Dannenhoffer with another of our Facebook Live events. So we're going to be taking questions tonight, and I'm wearing the latest in fashion here, as you can see, with face coverings. There's lots of different face coverings out there. I've seen some neat-looking masks, some interesting bandanas, some balaclavas like this. And so I'm going to take this down for now so that people who read lips can see me. This one is nice because you don't have to touch your face when you do this. You can just do it on the sides. But there's lots of different ways to cover your face. And I would recommend that you do that when you're out in public and you can't maintain social distancing. So anyway, so we're here today. I'm also sporting the new buzz cut look. Since hair salons are closed, and we'll talk about hair salons later, we're having to do something to deal with our unruly hair. So let me give you an update on what's happening with COVID. We're up to about 2.5 million cases and over 140,000 deaths. So really, truly a dire situation throughout the world with COVID. The WHO said today we're not nearly at the worst of it in many countries, and I think that's correct. I see especially countries in Africa and countries in South America that are having huge increases in cases over the last few days, and I worry that we're going to see an explosion of cases down there. In addition, there's a really fairly dire situation in the United Kingdom. As you remember, they were a little bit behind the rest of Europe. And when we did the initial travel bans with Europe, we did include the UK because they'd had it kind of under control. But over the last few days, they've had a real big increase in cases and in deaths. So our prayers are with all of the people who are suffering through this. In New York and New Jersey and Connecticut, they've got a little under control. But, the thought was you'd see a rapid increase and then a rapid decrease in cases. So they had the rapid increase all right, but the decrease has been much slower. And what I'm afraid of is that we'll still see that decay of cases happen rather than over a few days, maybe over a few weeks or months. And I think the people in New York are getting tired. Some of these people have been working in these emergency rooms or in the ICUs, have been on call and working long hours for weeks and weeks on end. So fairly dire there. Throughout the rest of the country, we've seen some big outbreaks. There was a big one in the Smithfield meatpacking in Sioux Falls, South Dakota. That's worrisome because Oregon similarly has some plants like that where there are people together. Here, they're mostly wood fiber plants or wood lumber plants, and where people do gather, so we do worry about the possibility of outbreaks there. The other thing that we've seen is that there have been big outbreaks in jails and in prisons. Oregon has had 2 of their prisons with small outbreaks. But when we go back east, for example, to Ohio, they've had enormous outbreaks with well over 100 people in each of these prisons being affected. So those are the things that we're watching for. In Oregon, we continue to have a slow increase in cases. For about the last 2 weeks, we've had 20 to 80 or 20 to 100 cases a day increase. It hasn't really gone much above that, but it hasn't really gone that much down either. So rather than this being a steep peak up and a steep down, what we're seeing is a fairly steep coming up, and now it's kind of flattened out, and we're hoping that it's going to plateau and decrease over the next few weeks. But we really haven't seen a convincing decrease in cases in Oregon. In Douglas County, we're still at 23. We added one today. We had 1 positive case, which was a contact of a previous case, and we had 1 case removed from our total because they really were from a different state. So they moved back to their other state, and we got rid of that case and then added that new one. So still with 23 cases, 10 have fully recovered, and I think by tomorrow we'll report even more recoveries, and still 2 in the hospital, 1 here and 1 out of the county. So the situation really hasn't changed all that much in terms of numbers, and I attribute that to excellent work with social distancing and great work by our epidemiologists who are tracking down these cases and finding the contacts. Now that we're over 20 cases, we've again done the map here. So let me move to the side a little bit so you can see. And so the map here shows the areas where there have been cases, and it looks suspiciously like the last time, where there are cases in pretty much every populated part of the county. Still no cases way out in this area, but there aren't very many people out there. And not really on the edges, but again, not very many people live in those areas. So when we look at the outbreaks are pretty much as it was before. I think you saw in the newspaper over the weekend about several cases at the VA, and I think they have those well under control. So we are going to take some questions. I also, if we get a little lull here, there are a couple of things that people have asked about over the weekend. So what underlying conditions do the COVID patients have that died in Oregon? They had originally said diabetes, heart disease, and what about asthma? So these were, most of the people who died in Oregon have been older, and so many of them had high blood pressure, diabetes, heart disease, and chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is otherwise known as chronic bronchitis or emphysema. They did not specifically mention asthma, although I do know that some of the people in Douglas County have had some asthma. So we do think asthma is a risk factor. I looked back to the original Chinese data, and I couldn't find much about asthma. So how long should you quarantine after test? So the story is, if you're sick enough to get a test, you should consider that you might have the disease. So we would say that it should be the longer of until all your symptoms are gone in 3 days, or if you're positive, then there'll be a longer time, but symptoms are gone in 3 days, or when you get the test result back. So if you get the test, feel great the next day, you should still wait until you get the test results back. If you don't feel great right away, you should wait until your symptoms are gone plus 3 days. So Keith asked, would you support a slow opening of the economy in Douglas County? And I think everybody would. I think everybody would support an opening of our economy. You know, this has been a long time to be kind of locked down. We're going on a month now, and it's hurting. I saw today that even Mickey Mouse got laid off. They had 100,000 furloughs at Disney World, so no part of the economy has been spared from this. And so I go back to the guidance that the state has been using, and I think the guidance that the feds issued last week has been quite good. And it basically says we need to do 4 things to open up the economy. The first is that we need to see a convincing decline in the number of cases. And as I said before, I have not really seen that in Oregon overall. Douglas County has never had very many cases, so it's going to be hard to get a convincing decline. The second thing that other people have said that the amount you would need would be less than 1 case per million. In Oregon, that would only be 4 cases, so we're long away from that. The second thing that you need would be adequate testing. And we'll talk a little bit more about testing, but adequate testing means that you could get a test anywhere you would seek care. So if you'd go to the drive-in, that would be great. If you'd go to your doctor's office, you could get it there. If you would go to the emergency room, you could get it there. If you went to the urgent care, you could get it there. Right now, we're not there. The third thing that you need to have is adequate PPE for people. So PPE are the masks and the gloves and the gowns. And we're still very short on the masks and the gowns. And since you need that PPE to collect the tests, you need to have PPE to collect the tests, and we don't have that now. I've told the story before that there was a clinic who said we just have 15 sets of PPE left. Should we continue testing? And the answer is, well, if you use those all to do testing, then you won't have any when you have sick patients. So you have to get PPE. And the last thing you need to have is to people to follow up on the tests. Now, we have that in Douglas County because we've not had very many cases, and we've hired on extra people to do it, but many other areas have not. So once we got all of those things, convincing decline in cases, adequate testing, adequate PPE, and enough staff to follow up on the cases, then I think we could have a slow opening of an economy. Now, I will tell you that the rural parts of Oregon are a little different from the urban areas. The urban areas are still overwhelmed with the number of cases that they're getting. So we might have an approach that's different from different parts of the county. I don't know, but the governor is certainly getting good advice. Go from the bottom up here. So why is it so bad for diabetics? We don't really know. Diabetics seem to have an impaired immune response and seem to have lots of trouble with lots of things. Heart disease, certainly more likely. Strokes are much more common in people with diabetes. And obesity seems to be a real risk factor in this disease. And obesity and diabetes does go together. So I got stitches in the doctor's office today. Should I stay away from my family? Patty asks. Sorry about the stitches. I don't think so. I think if you were in the doctor's office today and didn't have any specific exposures, you should just treat yourself as normal. But for all of us, that means we should self-monitor for symptoms. If we're having any of the symptoms of illness, certainly if we have fever, cough, or diarrhea, we should call our doctors, and we should all look carefully if we get sick to stay home from work. So are smokers considered to be high risk? And there was a question last week, and it said, oddly enough, are smokers in a better chance or not? So I looked that one up, and it turns out the risk of smoking is about twofold over non-smokers. So the risk of bad disease and the risk of death seems to be twice as high in smokers as in non-smokers. So indeed, smokers are considered to be at high risk, but not just from this, from everything. Much more heart disease, much more lung cancer, much more COPD. So if there's anything that would be good to come out of this is please, when this is all over, talk to your provider and stop smoking. People say, well, you seem to be so excited about this COVID. What about smoking? What about car accidents? What about flu? We care about all of those things. Why we really care about this one is how fast this rose, and if we didn't do anything, how fast it would continue to rise. So Patty says, Trump said today we have plenty of testing. Do you feel the same? Well, I don't ever talk dirt on politicians here. I think what people are not recognizing is that there's many steps to the testing. So there are parts of the testing where there seems to be adequate capacity. So if we're talking about people sitting in front of a machine ready to do the test, we actually have enough of that. There are lots of labs out there with people ready to do the tests. But let me tell you the step from the very beginning. The first part is somebody comes in, you want to do a test. You got to get dressed in PPE. Is there enough PPE for every provider out there? Absolutely not. The second thing is you need adequate swabs. There are not adequate swabs. In fact, the president entered into the Defense Production Act so that we could get enough swabs. Then you need viral transport media. Viral transport media is very hard to come by. We do a lot of tests here, and we're always conserving the viral transport media as much as we have. So there isn't really a lot of viral transport media. The next is these tests are not easy to get in somebody's office, and so they really need to be available wherever you would seek care. Then the tests go far away, and until the last week or so, the turnaround time was really long. So you'll remember last week and the week before we were talking about turnaround time of over a week sometimes. That turnaround time is shortened now, so that's a good thing. But that turnaround time is going to be limited. If more people test, that turnaround time will lengthen again. And then the labs need enough kits. So there are a bunch of these machines out there. For example, Mercy has a machine that could test beautifully. They just don't have the cartridges to go with it. And then you need the people to go and follow up on those test results and do it. So is there enough testing? I think it's a very complex answer, and I think the answer we're getting from some of our politicians is pretty simplistic. So the ETA for the antibody test, Joy asks. I want to talk a little bit more about the antibody test. So the antibody tests are a blood test that look for antibodies, which are the things that your body makes to fight an infection. And so the antibodies that we know the best about are, for example, like hepatitis B antibodies. So you get a vaccine, they draw your blood later to see you have adequate level of hepatitis B antibodies so that you won't get hepatitis B. So those are fairly standard tests that we do and fairly standard things. So these antibody tests for coronavirus should be similar. There are a couple of problems with this. One is that the one that was first approved was marketed through Henry Schein, but because it was marketed in an emergency use application, even though it looks like a simple test that you should be able to do at the bedside, it needs to be done at a high complexity laboratory, and those are only at universities and state public health lab. There are no high complexity labs in Douglas County. So it does not look like we're going to be doing these at the bedside. Now, there are some manufacturers that are going to start offering them, some of the big labs, but we don't have an ETA for that yet. Now, there are some places that have done antibody tests, and the results are surprising in two ways. So I know 4 places that have done antibody testing. One of those is in Iceland. Iceland is a fairly small country that had a little amount of cases. And in Iceland, the number was 0.7%, so not very many people immune, although they did have a rush of cases. In Germany, they had one little small village where it really went through the whole village. Everybody thought they had it, and only 14% of the people had antibodies. In Los Angeles, there was an area that had a fairly high amount, and about 1 to 3% had antibodies. Now, only far less than 1% of people actually had COVID, so the antibodies suggest that a lot more people had it than actually ever got tested for it, but overall, a very small number. And then the last one is in Portland. They did a study where Providence collected 1,000 people, and they did that. And I was told the results were going to come out this weekend, and I still haven't seen the results. But that'll be the fourth piece of data and the closest piece of data. So what does that tell us? Well, it tells us all these people who said they were sick in January and February, most of them did not have COVID. The other thing that it tells us is that the level of background immunity is still very low. So even if you take the highest of these in Germany, where 14% of the people had antibodies, that means that 86% of the people did not. And the next time the virus goes through that community, there are going to be a lot of people who will get it. So to get enough people immune so that it wouldn't spread again, you need to get at least 85% of the people immune to it. And none of these suggest we're anywhere near that. So are the numbers at the VA included in the county total, Joy asked, and the answer is yes. So these are done by people's place of residence. So if these people were Douglas County residents, then they get counted in Douglas County. Now the problem is, in some of those things, is that people could live in a different county and come down to Roseburg to work, but in this case not. And then Sarah asks, are people getting reinfected? I don't know. There have been a number of studies where people who originally had COVID are sick again, and they test them, and they've got antibodies again. And we don't know if they ever really got over it the first time or just carried the virus in their system for a long time. It doesn't seem to be a high number, but it's enough that makes us worry that if you could get reinfected, that we're going to make it be really hard then to develop a vaccine, right? Because the way the vaccine works is they introduce the antigen into your body. Your body now makes an antibody response, which should keep this virus away. But if people who are already infected and presumably already made antibodies can get reinfected, that would make the possibility for a vaccine less. So I don't know about this. The numbers are still very small. It's just a handful of cases. So I don't really know what that reinfection means. So Denise asked, do we have the ability to test everyone if need be? So think about this testing. So, when you're symptomatic, you have fever, you have cough, you've got those things, you'll probably have that, most people will have that once or twice in a year maybe, but never more than once or twice in a month. And so if you tested everybody who was symptomatic, that would be 2 to 4% of the population. And you'd have a positive rate of about 1 in 20 or 1 in 30, typically what we've seen. If you were going to test everyone, even if they were asymptomatic, you'd have to test 100% of the population. And because you're asymptomatic 50 weeks out of the year or 48 weeks out of the year, you would need to test 3 times a week for 48 weeks. You'd need to have so many people tested all the time to do that, and their rate of positivity would be very, very low. And so nobody at this point is recommending testing asymptomatic people who are not exposed. I think what we'll likely get to is to test everybody who's symptomatic early on in the disease. What we saw in Seattle was that these people who worked in nursing homes frequently didn't get tested until a week or 2 after they were sick. That's way too long. You should get tested on the first day of illness or the second day of illness rather than waiting until you're sick for a week and go back to work in the nursing home. And then we would maybe want to test asymptomatic contacts of people of known cases. I don't think anybody would be looking at testing everybody because you have to do so many tests, and these are really uncomfortable tests. I think I've had it done twice. I'm not sure I would go back 2 or 3 times a week to get that done. So Travis said, I've been told that unless every person is tested, that all numbers are inconclusive and irrelevant. Well, there's a lot of absolutes there. I think we probably do want to test samples of people to see how many tests we're missing. And so we've done that a couple of times. We did that on the Diamond Princess, which was that cruise ship. We've done it on the Teddy Roosevelt, which is that aircraft carrier. And now in Corvallis, they're doing it in Corvallis where they're testing a lot of people, whether they're asymptomatic or not, to find out what the background rate is. So I think that is reasonable. Now, all numbers inconclusive. Well, the deaths are certainly not inconclusive. The number of people who have disease in the hospital are not inconclusive. But to know, for example, what the real death rate should be, you would need to test a lot of people. You wouldn't need to test everybody in the United States. Just like when you do a poll, you don't poll everybody in the United States. You can poll a sample and get a pretty good idea of what the background rate is. And that's, I think, what they're trying to do in Corvallis. However, in the two areas that we tested, that we got the most complete testing on the Diamond Princess and on the aircraft carrier, it spreads pretty quickly, right? So 3,700 people on that Diamond Princess cruise ship and 800 infections. And on the Teddy Roosevelt, 500 infections out of about 4,000 sailors. So it is pretty contagious. So have any of the positive cases been retested as negative? And the answer is yes. And so people who are positive don't have to get tested to be sure they're negative, but many have been, and some indeed are indeed negative. When you said some patients tested positive have high blood pressure, is that controlled or uncontrolled? That's a great question. And I went back to the original ones to know if it was controlled or uncontrolled, and they didn't split it out. Now, lots of us have controlled high blood pressure, and the question is, does that put you at risk? And I tried to find it, and I could not find the difference between controlled and uncontrolled blood pressure. So if somebody, it says posted, it might suggest tested positive and worked at a restaurant or a grocery store, would the public be notified? So the story is that if somebody worked at any place, it wouldn't be a grocery store or a restaurant, but anywhere, and tested positive, we would find their close contacts, and we would interview and ask the close contacts to self-monitor or quarantine. And so, in a restaurant, it would be very difficult to know who the close contacts would be. But we would think, for example, if there was a cashier at a grocery store, that anybody who went through that person's aisle would not be a close contact, because you would be physically separated, and at most the event would be just a few minutes. So Janice says, when do you think hospitals will reopen for surgeries? The answer is I would hope it would be sooner rather than later, although it's not exactly clear when that's going to happen. There are a couple of issues. One is we thought that the hospitals might get overloaded with patients, and except for a couple of the big Portland hospitals that do have a fair number of patients, the rest of the state hasn't been overloaded. So that was a good thing that we missed. The other thing is, do they have adequate PPE? Because when they reopen for surgery, let's say I go in and have my shoulder worked on, they're going to use a lot of PPE. The anesthesiologist, the scrub nurses, the surgeon, the assistant surgeon, the people in the recovery room are all going to use new PPE that they wouldn't use if I didn't have my shoulder operated on. And so that's going to use them a bunch of PPE. So we need to be sure that they have enough PPE so they don't use it up all for the surgeries and then not have it if we'd have another resurgence of cases, or for the people who work in the emergency room and having people come in. So I think at some point the hospitals will reopen for surgeries. I don't know where or when. So Tabitha asks, should I take my clothes and shoes off when I come home from being in public? And I actually saw something from the WHO website that suggests that you do not need to take off your clothes and shoes unless you were specifically contaminated. So if you said, well, I was working at a clinic and somebody threw up on me or whatever, then clearly I would do that. But if you have just a regular exposure, probably not. Now, taking off shoes is interesting. I lived in Japan for a while, and the idea that you would wear shoes at home was considered to be utterly repulsive, because your shoes would have debris on them from the outside, fecal matter, dog dirt, and stuff like that. And so it was absolutely repulsive. So since then, I almost never wear shoes at home for just that reason. But that's very much a cultural thing. With coronavirus, we do not think that shoes or clothes are a big source of infection. So how do you feel about Oregon being grouped with Washington and California? Will that slow our opening? Well, this is the weirdest thing. Actually, when you look at that map of when you could reopen, they think Washington and California will reopen before Oregon. And I went through that for an hour yesterday, and I still don't get the math on that. Oregon has far fewer cases every day than does California and Washington. And although we're smaller than those states, I think we're in a far better space. But if you look at the Institute for Health Metrics Evaluation, which is the model that a lot of people are going with, it actually suggests that Washington and California will go earlier than we will. I don't quite get that. So is Douglas County low on the list for supplies as compared to Portland? Joy asks. And the answer is no, we're actually doing pretty well. We've got three things that have made it better for us. The first is we've not had a lot of cases, so we haven't used up very much. The second is that Douglas County had a good supply of stuff before this all started. So many areas, the counties had nothing, and so that they had to rely on other people to supply them. We built up a pretty good cache of stuff here, so we were pretty well stocked beforehand. And I think the third thing is that the hospital has done a remarkable job of conserving their PPE. They're working with the VA to sterilize some of the PPE that they use so that they'll be able to use it for longer. So for those three reasons, lower number of cases, better supply to start with, and really innovative things that Mercy has done, I think we're probably a little bit better than the rest of them. However, we're still not great. You used to be able to just like call and buy a box of masks. So starting in about December, the kids in our pediatric clinic wanted to buy masks. At that time, so the kids, we got little Mickey Mouse masks and whatever, and order them on Wednesday. They were there on Friday. It was no big deal. Now, if you tried to order a box of masks like that, you'd be put on this incredibly long waiting list, and you may not get them for a long time. They'd cost 10 times as much as they did before. So we're still not back to the normal point. I want to get back to the point where you can order a box of masks on Wednesday and it gets there on Friday and costs $6. Ooh. So Dane, very good question. So what would you ballpark the R naught at the USS Roosevelt? That is a great question. So the R naught is that if you start with one case and that one person gives it to so many people and that person and the next people give it to so many people, what is that multiplier? Well, if you say that, so they thought that the crew got it, you have to know when you think the crew got this. They think the crew got this in Da Nang when they did a visit. And so the story was that there was one person that started with this in Da Nang, and then there were 500 people 2 weeks later. The R naught is enormous. I think more likely that either a lot of people got it in Da Nang, maybe 20 or 30, in which case the R naught would be much less, or that it was maybe on the ship before that, and we finally first noticed it when they were in Da Nang. But that is going to be so fascinating, because when you look that up, the number could be high. Now, we think that, for example, in the Diamond Princess, it was a space of 4 weeks, which was probably 5 incubation periods. You got 800. So again, if you do the math on that, the R naught on that was 3 to 5. So it's a pretty high number. So Amy says, how long do you anticipate it will be until non-emergent dental procedures will be done or optometry will be open? So the answer is I would hope soon. Optometry probably sooner than dental. Optometry uses less PPE than dental. Dental is a problem because in many cases, if I'm going to see a kid, we could both wear masks. The patient could wear a mask, I could wear a mask, and that would be fairly low risk. And we don't generate a lot of aerosols usually when I'm seeing kids. But if you've been to the dentist, they're all scraping away and using those high-speed drills and squirting things in your mouth and whatever. So they are creating lots of droplets and lots of aerosols. So we worry about not only maybe a sick dental person making the patient sick. Here you've got your mouth open. If they're sick, all that stuff is coming in. Or if the patient is sick and then coughs and sneezes, and there's just a lot of aerosols there, will you get them infected? So I don't know when that's going to actually happen for dentistry. The concern is we were not ahead on dentistry before. So, if this wasn't like, well, everything was perfectly hunky-dory, everybody had perfect teeth, we could wait 6 months to do this. Dental care in Douglas County is so critically important. And what I tell people is you may have had a little cavity in January, February. What is that going to look like in September? You'll have a big hole then, and it'll be much harder to take care of than before. So I actually don't know about dental. How are we going to build immunity if everybody stays home? So there are 2 ways to look at this. One is you could have everybody stay home and people wouldn't get it because they just wouldn't be exposed. The second way is you could have this burn through a population where everybody now would get immunity and then it would be over with. And so there's certain diseases we allow to just burn through the community. So, for example, there's something called hand, foot, and mouth disease. You probably have maybe seen this. Kids get this. Probably every kid gets it. They get little blisters on their hands, little blisters in their feet, and blisters in the back of their throat, as well as on their butt. But we don't call it hand, foot, and butt disease, but we call it hand, foot, and mouth disease. And that's a disease that it doesn't have very many bad consequences. There's no treatment for it, sort of like this. But since there's no bad consequences, we just let this burn through. We don't try to specifically stop this or quarantine people when they have it, because we know that it's going to burn through. And indeed, you rarely see this in adults, because most times adults have had this when they were kids or teenagers, and then they don't get it again. So that's an example of something that you let it burn through, everybody get immunity, and people would be fine. The problem with this one is that if you let this burn through, it would be in every nursing home, and 15% of people 80 and above would die. In Oregon, this would be a lot of deaths. So when we looked in Douglas County, it would be 500-600 deaths of seniors, as well as some deaths of people in their 40s and 50s. And so letting it burn through, you could do that. That would be an option, but you'd have to be willing to accept lots of deaths. So if you're going to say, look, 1,000 people died in Douglas County, we're going to live with that, then you could maybe do it, but it's a lot of people. So we think it would be 1% of the population if you just let it burn through, had a 70% attack rate. We think about 1% of the population would die. That's 1,100 people in Douglas County. And that would be many old people. That would be a lot of people in their 60s. And it would be quite a few people in their 20s, 30s, and 40s. And so that's an option. I don't think any country has chosen to go with that option. The UK initially said they would do that, but when they saw what the death rates would be, they pulled back. They said, well, what we'll do is we'll just have all the vulnerable people stay home. And it turns out that that was just not viable. I mean, when we look at nursing homes, the people who work in nursing homes frequently are going to be young people. And so you're going to let the disease burn through them. They're going to be working. And when they work in a nursing home, they can make a lot of people sick. So that's a possibility, letting it burn through. But I don't think that makes great sense, because I think the death toll would be enormous. So Dane says, could you address the Stanford study? There are 3 studies from Stanford. So let's see if you could, Dane, you could put back and tell us specifically which one. So when viruses mutate, do they become more virulent, Dane asks. And the answer is maybe. So somebody said one time, imagine the viral code being like a joke, and mutations were a slight change to that joke. Does the joke usually get funnier or less funny with time? And usually less funny with time. Although there could be the one time where we get more funny with time, and certainly there's a chance that the virus might get more virulent once it spreads. What we think happens is these viruses spread in bats, and bats carry thousands of these viruses, and there's a lot that become less virulent, and there's 1 or 2 that become more virulent, and those are the ones that spread. In this, generally viruses become less virulent with time, although they will change sometimes and cause issues. So one of the things that we see with flu is that they make the flu vaccine, if they pick in January or February what the flu bug they're going to do is, and frequently they'll pick a flu vaccine, and by the time it circulates in the US 10 months later, it has mutated. It's not necessarily more virulent, but it's now not protected by the vaccine. So that how fast this virus changes is kind of a double-edged sword. If it changes very quickly, it may become less virulent and die out, but it would also make a vaccine then much less likely to work. So we're not sure about this. This appears to be mutating at the typical rate that RNA viruses mutate, which is a few base pairs per multiple transmissions. So when you look at the code for this, and you can actually find the code online here, what the code is, it's one long string of the ATCGs that go out for, like, if you printed it out, it's like 30 pages printed. And typically what happens is there'll be one little change in there. There'll be not much of a difference in things. And that's what you get. And And those are the mutations that you see, typically in parts of the code that are not important. Presumably, if there's a code that's important, the virus no longer works. So have we hit our peak yet? So the peak is a lot of peaks, right? So we hit our peak in active cases? It depends upon where you look in the world. The world clearly hasn't. Oregon, if you look at new cases, Oregon may be nearing the peak or at the peak of new cases. If you're looking at new deaths, we are probably past our peak of new deaths in Oregon. We are certainly not at the peak of our active cases, because remember, those cases from 2, 3, 4 weeks ago may still be active. So we're still not at our peak of active cases. And we're clearly not in a place where you could say we're clearly on the downward trajectory, because you have to recognize that when we do open things up, we expect there to be more cases. So we fully expect that as you open things up and people start doing things and getting close to people, that these things may spread. Because there's nothing to say that this couldn't spread in a prison. There's nothing to say that this couldn't spread in a place that you opened up again. So I think we're at or near our peak of deaths, at or near or peak of new cases, but certainly not at the peak of active cases. So Amy says, after patients recovered, are we retesting them? Are they still contagious? So we're following the Oregon guidelines, and the Oregon guidelines is we're considering recovered to be all symptoms plus 3 days. Oregon does not have a recommendation for retesting, although, as I said, we have retested a lot of these people, and most of them are virus negative. So we see the number of tests that are being done. How many of these people have had multiple tests, Veronica asks. We don't think very many here in Douglas County. So that's one of the things that you'll see, for example, in China. They had a lot of tests, but many of these were repeat tests or multiple tests on the same patient. We do not think that we've had very many multiple tests. When we look at our numbers, we're 600 some odd numbers of tests. We think those are almost that same number of patients. So Veronica says, what do you think is the chance of a bigger or second spread if we open up soon? Well, there clearly is some chance. There clearly is some chance, and it depends upon how good we do with our social distancing in the future. I mean, I don't think anybody's suggesting that we flip a switch and we go back to like it was in December, where people would have big parties and hug and kiss and sit next to each other on the plane. I don't think that's what people are talking about. I think we're talking about opening up in a careful enough way so that the number of cases continues to go down, although it may not go down quite as fast as it was if we continue the social distancing, but that the number of cases continue to go down. So Tabitha asks, so how do you guys in public health determine when this is over? Well, so there are some diseases that are over, like the Spanish flu was over. There were no more cases of Spanish flu after 1921. I don't think this is going to be over until we get a vaccine. And even when we get a vaccine, it's going to depend upon how effective the vaccine is and how many people in the world get the vaccine. Right? So even the best vaccines, we only reach about 90 or 95% of the people, and the vaccines themselves, although they can be pretty effective, they're certainly not 100% effective. This one, I would think, if you got 80% of the people and it was 80% effective, you'd still have enough people out there that you might still see cases. And unless you did this vaccine worldwide, as people traveled or as people came into the country, you might see it spread. So, for example, Singapore, which really had pretty much gotten rid of this and been down to a low number of cases, has had a huge number of cases over the last week as people come into the country as foreign laborers. So we're going to have an issue there. Now, I mean, maybe this will change things in terms of international travel. If it doesn't, and people are still traveling around the world, this will be an issue. But if we stop international travel, what we do with cruises? Are we going to get rid of cruises? Are we going to get rid of people visiting friends and relatives overseas? I don't know. So Sky asks, when using an oximeter, when should you be concerned to seek medical attention? My son's decreased from 99 to 95 in hours. So the way the oximeter works, it has this laser light, and it looks at the color of your skin. And the color of your skin is very red when your oxygen level is high, and then it is bluer when your oxygen level is low. So every time your heart beats, the blood that goes in the capillaries starts out coming from your heart, so it's got a high level of oxygen, and then as the heartbeat stops, you get a little backflow of venous, of desaturated blood, so it goes down. So if you look at the curve on here, it looks like a sawtooth pattern, and it gives the difference between the high and the low, and that's the oximetry. Oximetry is very, very effective. A normal oxygen saturation is 92 and above. So 95 is still normal, but I'd watch that and see. And when you look at oximeter, frequently when you first put it on, especially your hands are cold, the number is going to be low. The highest number is always the correct number. So sometimes you put it on somebody's finger and say, oh, it's only 86. Give it a minute. And then it goes up to 96. The 96 is the right number, not the 86. So the highest number is always the right one. So Patty says, my block is having a party. We have been advised to be 6 feet apart and use masks. Are there any issues with potluck food? And are there any other ideas to be safe? Well, it's kind of interesting. I think we're going to see kind of things like this, maybe block parties where people are more distant. You can still talk and enjoy people from 6 feet away. Any issues with potluck food? Not really. Food, especially if it's heated, really doesn't carry lots of germs. So I think that would be an idea. Any other ideas to be safe? Well, certainly if anybody was sick, even if they were masked and 6 feet away, they still shouldn't be at the party. Would you recommend the county open up parks and campgrounds? Ashley asks. So the story on parks and campgrounds has been that a couple of things. One is that when you open up the parks and the campgrounds, somebody needs to go in and clean those. And again, many employers have been keeping their workers furloughed or at home, so they didn't need to be out. So once you start opening up the parks and the campgrounds, people need to go pee, and so that you'll need to then also do the bathrooms. The other concern that they've had is in places when they've opened up parks, there was a lot of congregation. So you only had to see the pictures of the Chinese parks that opened up after their lockdown, where there were thousands of people crowded on a little trail. And that would obviously be a time where people could spread disease. So as long as you had social distancing and somebody who could help clean up afterwards, we might be able to do this at some point. Parks and campgrounds are now been closed, but that might be something that in the first or second phase you could open up. So Wendy asks, all this testing and tracing doesn't seem realistic long term. Are we just treading water until a therapy or a vaccine comes? And the answer is yes. This is not realistic for 10 years or 12 years, because even during that time, there's still going to be very significant social restrictions on travel and other kinds of things, on businesses and whatever. So you're right, this does not seem realistic for 10 years or 5 years. But again, if we can get a vaccine within the next year or so, I think we can probably do it over the next year or so. But you're right, it does seem hard. It does seem like what happens when schools get back. Kids are going to get a lot of illnesses, or we're going to be testing kids a lot every time they get a cold. I don't know. And so this is part of the future I'm not good at. So Ron asks, any ideas on how to open restaurants? Well, I do have some ideas. I don't know if they want to hear from me, but right now we've done takeouts and that's worked out okay. About half of the takeouts actually have places to sit. You could imagine takeouts, places like Subway, where you'd have half as many tables and people could sit at half as many tables being 6 feet apart, and the groups being groups that have already exposed each other, family units or others that have already exposed each other. You could see that being a way. And I think probably when we open things up, we're going to be opening things up a little bit and see what happens. If you open up things and still the cases seem to be going away and decreasing, then you can open a little more. What you wouldn't want to do is to say, well, just go back to normal and then have a big explosion of cases and then need to do a shutdown again. I think that would be really hard to convince people to shut down again once they opened up. So I think what you're going to see is sort of a gradual reopening, which gets us to the hair salon. So you like the little buzz cut here. My wife did that for me. But, at some point, hair is going to continue to grow, except for up here. Hair will continue to grow. And because of that, people are going to need to go to the hair salons. But how do you do that? Because, you've got to be within 6 feet of your hairdresser. You obviously cannot do this remotely or at a distance. And so how do you do this so that you protect both the person who's getting their hair done as well as the hairdresser, who might have a dozen or so clients in the day? And even if one of those is sick, they might be at risk. So we're going to have to think about ways to do that, to help decrease the risk to do that, because people are going to need to get their hair cut. So Sharon asks, if you survive COVID-19, do you have other long-term after effects, and what are they? And the answer is, well, this disease is not out there for a long time, so we don't know. But there are some worrisome early reports. One of the early worrisome reports is what we call cardiomyopathy, which is a weakened heart. So the heart is a muscle, and it squeezes that blood out. And what we've seen with COVID is that the heart is really considerably weakened. And we do not know if that weakening of the heart is going to be long-term. The second thing that we see is that a lot of people who have this bad wind up having kidney failure, and they're on dialysis. And again, we do not know if their kidneys will recover. And then just this week, there was a report about some neurologic damage, people having delirium and other thought problems from this. And that seemed mostly to get better as people got better. But we do not know. We don't have the long-term psychological things to know if this is going to affect dementia. Now, we do know that when old people get sick for whatever reason, just a fall even sometimes, that sometimes dementia they have will really worsen. And since it's been such a bad disease for old people, what we worry about is that people who maybe had mild dementia would get this disease, but when they recovered, they would have even more severe dementia. So those are the long-term things that we're really going to have to look at. So the question is, could the virus have been brought to the VA by the disinfecting of Mercy's PPE? And the answer is no. The onset of all these cases was before any of that happened. So that's the one thing I can answer fairly definitively. And that was not the case. So it looks like we're getting low on questions here. I had just one more thing about some questions we got. One was about somebody who was just irate that people were not adequately social distancing, and should they ram their card or give them a good talking to or whatever. And the answer is I don't know. In Oregon, we don't have social distancing police. Workers can complain to OSHA if they're concerned that their workplace is not doing the right things, but there's nothing that would prevent one customer from being close to anybody else. But I was out this weekend. We did this thing in Reedsport, so I was out this weekend. And there was one guy who was a little close, and I said, "Ooh, could you stand back?" And they were very nice about it. So I think if you're just nice and kind and gentle about it, for the most part, this will work. The other question that we had about the antibody tests, and the antibody tests, as we said, are going to be problematic. And the reason they're going to be problematic is that unlike the nucleic acid test, the swab test, which is a very standardized test that looks for molecular material, the antibody test has got all kinds of vagaries in it. Does it look for IgG or IgM or both? How specific is it for this coronavirus rather than the other coronaviruses? And how sensitive is it in picking up the amounts of the antibody? Well, it turns out that there are 70 different companies making this, and all of those 70 different companies have different answers to those questions. Some pick up to IgG, some pick up IgM, some pick up both. Some are incredibly specific for this new SARS coronavirus, SARS-2. Others have cross-reactivity with the other coronaviruses that cause colds. And so, unfortunately, I think that the results we're going to get on the antibody test are going to be accompanied by huge asterisks. So they're going to say, 6.6% based on this test, or 3.8% based on this test. And it's going to be, I think, months until we have kind of a standard in terms of what the antibodies show. And that is incredible disappointment, because I think for those of us who were interested in knowing this, getting that kind of mushy data is going to be infuriating. So if somebody dies of complications of COVID, will they be counted? The answer is yes. So, for example, let's say you had COVID now, survived the acute thing, but then later on died, of kidney failure related to the COVID. Yes, that would be counted because you get counted when you get diagnosed. Now, we have people in New York City, they saw a bunch of people who died at home, and they counted many of those people who had respiratory conditions as having COVID. We have been able, in anybody who's died and has any symptoms suggestive of COVID, we've been able to test them. They've all been negative, but if you died of complications of COVID, you should be counted. Okay, is that it? All right, not too bad. So again, this is Dr. Bob Dannenhoffer. A couple of things. Be nice to each other. I think people have been incredibly nice over the last little bit. Just tiny little things of joy. So people I saw today, I went for a little walk, which I encourage everybody to do on these nice days. I went on a walk, and there were two people who were standing about 10 feet apart, just chatting. And just chatting like they would normally chat, but normally they'd be within a foot or two of each other. In this case, they were 10 feet apart, having a great old time, talking about stuff and whatever. So I'd really encourage, although we're physically distant, not to be socially distant from people. So you can still talk with people from 10 feet apart. And I actually brought them a coffee, and we did the quick 6-foot handling there so that they could have their coffee. So again, be nice to each other in this nice weather. Get out and enjoy. There's nothing to say that you shouldn't go out and walk your dog as long as you can be socially distant from others. There's nothing to say that you shouldn't take a run or a bike ride as long as you can socially distance. So again, be nice to yourself. We really, truly will get through this. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you.